On coronavirus outbreak and preventive response towards stemming its spread in Nigeria. This Senate aware that according to medical definition, coronavirus is a type of common virus that infects humans, typically leading to an upper respiratory infection, and 7 different types of human coronavirus has been identified. This Senate informed that the viruses are spread through the air by coughing and sneezing, close personal contact, touching an object or surface contaminated with the virus, and rarely by fecal contamination, and the illness caused by most of the viruses usually lasts a short time and is characterized by runny nose, sore throat, feeling unwell, cough, and fever. This illness notes that examples of human coronaviruses that have been reported to cause severe symptoms include MERS-CoV, that's the beta coronavirus that causes Middle East respiratory syndromes, or MERS, or SARS-CoV, the beta coronavirus that causes severe acute respiratory syndrome, or SARS, and the new 2019 novel coronavirus 2019 nCoV outbreak that began in Wuhan in China. This Senate worried that China has put millions of people in 3 of its cities on lockdown in an effort to contain the coronavirus outbreak that has killed over 170 persons and infected more than 630, and health officials fear the number of infected people will rise rapidly as hundreds of millions of Chinese people travel within China and abroad during this week-long Lunar New Year holidays, which began on Saturday. This Senate comforted that the Federal Ministry of Health, through the Nigerian Center for Disease Control, NCDC, a product of the 8th National Assembly legislation, has risen to the occasion and is closely monitoring this outbreak of respiratory illness caused by a new coronavirus. This Senate informed that the aviation regulatory agencies recently stepped up surveillance across operating and international airports nationwide in a bid to contain any case of the coronavirus pandemic, while appreciating and standing by the federal government's travel advisory that Nigerian nursing travel plans to China to put them on hold until further notice, save under an extremely essential circumstance. Accordingly, this Senate resolves to, 1, to thank the Federal Ministry of Health through the National Center for Disease Control for their gallant efforts at stemming the coronavirus infection in Nigeria, and urge them never to lower their guards on this until this fight is won internationally and here in Nigeria. 2, urge the federal government to allocate more funds to the National Center for Disease Control, NCDC, to acquire the latest and most recent equipment that there is for research and diagnosis of tropical diseases that threaten human existence, as prevention is always better and cheaper than cure. 3, urge Nigerian traveling public desirous of traveling to Asia, especially China, to heed the federal government travel advisory on China and put their travel arrangements on hold till further notice and until this outbreak of coronavirus is vanquished from the surface of the earth. 4, urge the Federal Ministry of Aviation to ensure that all persons arriving from China, especially the Chinese citizens from Nigeria that travel home for the Chinese Lunar New Year festivities, or from any country that has a major disease outbreak, to self-isolate by staying indoors in their homes for at least 2 weeks before mixing with the Nigerian public. 5, urge Nigerians with any reported cases or of likely infection or with symptoms that approximate to those associated with the coronavirus to visit the hospitals for urgent health check. 6, and finally, as cleanliness is next to godliness and prevention is better than cure, Nigerians at all times are advised to wash their 2 hands with soap, with clean water, preferably from a running tap. I so move.